Do you know what Obamacare is?
Oh, Obamacare is where he wants everyone to have health care. Isn't that a thing? Everyone? Yeah. That's what I know about healthcare.
America's healthcare is confusing to follow, and definitely not part of an average American's knowledge. We were no exception to this rule. We know that there are lots of things said about the current system, but what really is the truth? We decided to find out for ourselves what the deal is with America's healthcare system.
Alright, let's go.
So we settled down to do some research and get an idea for how healthcare is run around the world. Essentially, there are two major systems for how health services are provided: privately run healthcare and government-mandated healthcare. Of all the industrialized nations, the United States is one of the few that lacks government-mandated healthcare. But we still didn't know which system is better. We then found that the United States has one of the least efficient healthcare systems in the world today. Countries like Mexico, Libya, and Peru all have higher efficiency scores than the United States. Even further, with cost, the United States still lags behind as an outlier, boasting one of the highest costing systems in the world.
Are there any nations doing it right? Yes, the United Kingdom is widely known as having an extremely efficient system of government-mandated care for all citizens, and to say the least, the United States does not stack up well against them. Here are the stats. Let's say one head equals 1 million adults. In the past year, 88 million American adults went without care because of cost. If we had the same system as the UK, only 10 million adults would go without care because of cost. But how high is the cost? Let's make one of these dollars represent 100. The average amount spent on healthcare per person in the United States is $8,800. This number is one of the highest in the world, surpassing the vast majority of other industrialized countries. To put that in perspective, the United Kingdom spends only an average of $3,300 per person. Looking at the sheer size of these gaps, you would think that this was the difference between a third world and a first world country. The United States, arguably the world superpower, is leagues behind the best country in the world at healthcare. Think about all of the money that could be better spent.
However, we figured that statistics can only tell us so much, and decided to interview an actual British citizen to see if Britain's healthcare system on paper matches up with its everyday application. This is Andrew, a British citizen we had the pleasure of talking to about the UK healthcare system. We asked him about his experience with health services.
On the whole, it's been very good. They've saved my wife's life at least twice for free, so that's nice.
So far so good, right? Next we figured that we would get an idea of what Britain's general attitude is towards healthcare.
Most people would see healthcare as something you are entitled to by virtue of being a citizen of the country. It's one of the things for which the government taxes its citizens.
So the United Kingdom does claim that it is a right to have healthcare, not a privilege. With that in mind, what does the UK think about the American system?
I think most people find the American system odd, slightly mystifying. We can't quite figure out how you got yourselves into such a bad situation. You spend at least twice as much as your nearest European competitor, as it were.
Yeah.
So it's a very good example of why the market is not always the most efficient system.
Mm-hmm.
And you don't give healthcare to all your citizens, which strikes us as a little bit barbaric or uncivilized.
But the big question remains, how far does their system go? What about the extremes of the health world, like cancer patients? How is their care covered, if at all?
But so how about like chemotherapy for cancer?
Oh, yeah.
That's
Yeah.
all. That's free.
Yeah.
Oh my goodness.
Yes.
That is free.
That's insane.
Think about that for a second. This system seems to work well, both on paper and in real life. Is the United States doing anything to replicate this system? Yes. Barack Obama took a step in this direction when he implemented the Affordable Care Act. Obamacare, as it has come to be nicknamed, essentially is an 11-year plan aimed at cutting away some of the privatization of healthcare, but reducing cost and making healthcare more accessible via a government provider. Over the 11-year period, individual healthcare plans must now allow children to stay on their parents' plan until they are 26 years old. The cost of prescription and brand-name drugs will be steadily reduced, Medicare payments will be reduced, and the scope of Medicaid will be expanded 133%, among many other new changes and reductions.
Now that the Affordable Care Act has had a few years to kick in, has it started to affect the system? We decided to interview a professional inside health services to find out.
Hi, I'm Caitlin.
I'm Donna.
Good to meet you.
This is Donna, a nurse practitioner that has worked before the installation of the new system and still works in health services now after Obamacare's implementation. We started by asking her in general how health services are in the U.S. today in the most current system.
So quality of care is quite good. Actually, at this stage of the game, I think that we have more people seeking healthcare, which is wonderful. It's really has the potential to make our society in general more healthy and seeking less expensive care down the road by doing more preventive care. And in that regard, I feel like the quality of care is better because there's improved access to care just in the few years that I've been practicing.
So essentially, the Affordable Care Act does cut costs in the long run, as it favors general visits that keep people healthier and prevents extraneous or emergency care later on. Then, we asked her about her professional experience with Obamacare.
I love keeping people healthy. That's why I went into healthcare, not so much to take care of sick people, although I am passionate about that, but to keep people healthy. So I love doing vaccines. And people are now able to access that. That is preventative care. And in the Affordable Care Act, part of the mandate is that preventative care should not be a financial burden to people. If we want people to be screened, then you have to take the co-pays out. And I see people now accessing vaccines at a much higher rate than I did before. They're accessing their preventative care much more because they don't have to pay a $40 copay or a $25 copay or whatever. Every day when I do my flu vaccines on my patients, I say to them when I give them their receipt, and I say, here's the receipt and this is how much your insurance is covering, and they ask me, well, don't I have a copay? And I say, no, you don't, because that's part of Obamacare. That's the Affordable Care Act. It says your preventative care shouldn't be a burden to you.
So, the reduction of copays and additional bills is a huge victory for the healthcare system in the United States. It makes care more accessible, more appealing, and cheaper for all Americans. To finish, we asked Donna about her own personal opinion about the Affordable Care Act as a whole.
So what's your personal stance on the Affordable Care Act?
My personal stance is that I am all for it. I'm for it as a consumer of healthcare. I am very for it as a provider of healthcare. No healthcare system is perfect all the time. I think we're getting there with this. My personal and professional opinion is that we should be moving to a single payer system like the UK has. The best healthcare outcomes come with that system, and it's the least expensive. And I think in terms of our economy, I'd like to see those dollars go into the economy differently than funding a bloated healthcare system that doesn't keep people that healthy. So I would love to see things move in that direction, but I think we're in a really exciting time to move forward in that direction.
There's the mention of the United Kingdom system again, from an actual professional nurse practitioner working in the United States. With Donna's help, we realized that the current system is a great step in the right direction, but should not be the end goal. Andrew showed us that the US needs to continue to gravitate towards a system like the single-payer British one. All things considered, the data, the real-world testimony, we ultimately found that until we get there, rates of health insurance will continue to disappoint, costs will continue to be a problem, and healthcare in general will still be considered an unsolved political issue in America. All in all, with America's world power, wealth, and intelligent thinkers, hopefully Obamacare will be just the beginning of the end, as a government-mandated, single-payer system rises from the ruins of an expensive and inefficient attempt at a private system.
Okay, this song. I'm probably gonna cut out all the music, or like all the sound in all these videos, so that we can use it for anything.
Yeah.
Did you say no kidding?
Well, we were really gonna put in the.
Yeah, I was gonna say,